Order. Sir David Evannett to move the motion.
Thank you very much, Mr. Dowd. A pleasure in moving the motion and pleasure to serve under your chairmanship this afternoon. And I'm incredibly grateful to be able to raise the important subject of tackling obesity today in our debate, one that I believe is very important, of vital importance to the future of our country. Grateful to see colleagues from both sides of the House here this afternoon. As we have to tackle obesity, it requires, I think, a cross-party approach to the subject. I particularly welcome my right-honourable friend, the Minister, who is also a personal friend, and I've worked closely with her in the past, and now how interested and concerned she is about this issue. Obesity is a major public health problem and a global concern. According to the World Health Organization, worldwide obesity has nearly tripled since 1975. Most of the world's population live in countries where issues with being overweight and obesity kill more people than issues associated with being underweight. And 39 million children under the age of 5 were overweight or obese in 2020. Quite shocking statistics. However, the problem is of particular concern in the United Kingdom, where we have the third highest obesity rate in Europe, behind only Malta and Turkey. We are the third highest in the G7, behind only Canada and the US. Almost 1 in 3 adults is now classified as obese, a dramatic increase from the 1 in 10 adults in 1970. The increase we've seen in this country is much greater than in other Western European countries like France, Germany and Italy. The Health Survey for England monitors trends in our national health and care and found a higher proportion of men than women who are either overweight or obese, 69% compared to 59%. The highest rates of obesity were also among the lowest socio-economic groups. Almost 70% of people in the most deprived quintile of English localities as classed with living with obesity or being overweight, compared with 59% in the richest. Of course.
Of a AGM to do it at 5 o'clock, and I would have been here to participate in this debate only for that. But according to the Department of Health, that's for us back home, 65% of adults in Northern Ireland are obese. That's quite a shocking figure, I have to say.
Yes.
There is now a plan for a consultation that highlights the need to make healthier food more affordable. Does the honourable member agree that there must be a priority for every region of this great United Kingdom of Great Britain and Northern Ireland, and this must be done in partnership with our own agri-food sector, because they have a role to play, maybe a financial role as much as a guidance role? And does he feel that when it comes to the Minister replying, maybe the partnership with DEFRA here might be something that would be advantageous?
Well, I'm very grateful for the honourable gentleman giving us the information in Northern Ireland, and of course it is something we've got to work across the whole of our 4 countries making up the United Kingdom, and I'm sure cooperation is the best way forward. But of course behind these statistics, Mr Dowd, are real people, our people, not just statistics. Parents, grandparents, children, friends, neighbours. Overweight people are more likely to experience other health issues as a result of excess weight. There are real consequences too for the quality of life of our people. People who are obese are 7 times more likely to develop type 2 diabetes. 11% of obese adults reported in the Health Survey for England that they had diagnosis of diabetes from a doctor. The figure was less than half in overweight adults at 5% and just 3% for those who are neither overweight nor obese. People with obesity are 2 to 3 times more likely to have high blood pressure and other consequential health issues. It's also a risk factor for depression and associated with social isolation, less physical activity, contributing also to the increased risk of dementia. Obesity between the ages of 35 and 65 can actually increase dementia risk in later life by some 30%. Of course, excess weight also puts strain on joints, increasing the risk of musculoskeletal conditions. Other health problems from excess weight include cardiovascular disease, liver disease, and many common cancers. Obesity is actually the second biggest preventable cause of cancer. As well as the cost to individuals' health and well-being, there's the real cost to the economy, businesses, jobs, and communities. The Times newspaper reported yesterday that 60 senior health experts, including the heads of the Royal College of Physicians, the Royal College of Anaesthetists, the Royal College of Midwives, the Royal Society for Public Health, and dozens of health charities, have written to my Right Honourable friend, the Chancellor of the Exchequer, urging him to put tackling obesity and other public health issues at the heart of his budget next month, for the sake of the economy. This plea is not just about healthcare, it's about the economic vitality and future of our country. This coalition of doctors, scientists, charity bosses and food campaigners say poor health is one of the greatest threats facing Britain today and warn it is damaging the economy, from the size and strength of our labour market to productivity, to growth and to GDP. They also say the vast majority of health conditions contributing to economic problems are driven by poor diet, alcohol and tobacco. They cite the work of the Independent Times Health Commission, a year-long inquiry that called for stronger government intervention to tackle the growing obesity crisis, that recommended a number of interventions to combat obesity, including an expansion of the sugar tax, curbs on cartoons on packaging, and a pre-watershed ban on junk food advertising on television. The experts urged the Chancellor to issue a formal call for evidence on financial and non-financial health policy options that make it easier for everyone to lead healthier lives by shaping the environment they grow, learn, work and play in. They conclude with advising the public overwhelmingly believe the government should have a stronger role in acting to create healthy lives and take some of the pressures off our NHS. The Times editorial of yesterday makes a convincing account of the issues and the need for action under the heading body politic. It also notes that merely increasing taxes on already hard-pressed consumers is not the way forward. It should be encouraging the switch to healthier products. I agree with that assessment and also find it increasingly worrying that Frontier Economics estimates in 2023 that the total economic impact of obesity was £98 billion, accounting for the cost of the NHS, social care, lost productivity, work inactivity and welfare payments. Obesity-related ill health does reduce workforce productivity. People living with obesity are estimated to have 4 extra sick days a year annually, approximately equivalent to an extra 37 million sick days across the UK working population. Estimates put the annual cost of obesity at 1 to 2% of GDP, with obesity rates continuing to soar. This is only likely to increase. Obesity places a heavy burden on the NHS. It contributes to the high workloads in GP surgeries, hospitals and social care, adding to the pressures that we're already experiencing. Tackling obesity has actually been on the political agenda for many years. In 1991, the then Conservative government recognised obesity was a sufficient threat to the health of the nation to warrant specific action. The first target for reducing obesity rates in England was set, which was to achieve a return to 1980 levels of 7% by 2005. This target was sadly missed. Over the last 3 decades, there have been various strategies, countless policies, and many reforms with key agencies and teams created and abolished. Despite this, as highlighted in the statistics previously I've mentioned, the issue is still very much prevalent. In my own borough of Bexley, the issue of obesity is one we are statistically performing relatively badly, unlike in other areas, Mr Dowd, where Bexley performs extremely well. Last month, Bexley was dubbed the fattest borough in South East London after the Office of Health Improvement and Disparities published information on the percentage of adults over 18 who were classified as obese. According to the report, the Bexley had the worst obesity rate in South East London at 28% of the population. Yet we have in recent years been very successful in my area on health issues. The Stop Smoking campaign was a great success, and I was privileged to be involved in it. The number of smokers in our boroughs considerably reduced because of the NHS campaigns, the council campaigns, and people like myself adding to the campaigns. However, we have real issues with childhood obesity, and Bexley Council have endeavoured to be proactive in improving the health of people across the borough, as well as implementing an obesity strategy in 2020. However, despite this, childhood obesity rates in Bexley have worsened following the coronavirus pandemic. Digital figures show 745 of 3,095 Year 6 pupils measured in Bexley were classed as obese or severely obese in 2022-23. Across England, 13.9% of Year 6 pupils were overweight, and a staggering 22.7% were obese or severely obese. This was slightly down on the previous year, but still pre-pandemic figures. This is extremely worrying, and childhood obesity is a major public concern in its own right. Children who are obese are 5 times more likely to become obese as adults, and this puts them in the higher risk conditions previously highlighted, as well as shortening life expectancy. As the majority of obese children will remain obese as adults, early intervention is essential. We have to act early in their life before they suffer complications later on due to something that was avoidable. The government has taken some action to this, and in 2018 set a target of halving childhood obesity in England by 2030 and reducing the gap in obesity between children from the most and least deprived areas. However, whilst necessarily meeting the target, unfortunately, does not seem possible at this current time. Yet, despite all the health problems, the impact on lives and the cost of the economy, we must remember obesity is, in many cases, preventable. Action is required by individuals, parents, schools, government, media, and the food and drink manufacturers. Well then, what can be done? What should be done? Basically, as a nation, we're simply consuming too many calories each day. According to Public Health England, many adults consume an extra 200 to 300 calories a day than needed, while children who are overweight or obese often consume an additional 500 calories a day. The NHS needs to do more, as public health improvement will ease the pressure on GPs in our hospitals. There does, of course, need to be an emphasis on the individual in tackling obesity. At an individual level, people can limit energy intake from total fats and sugars, increase consumption of healthy foods, particularly fruit and vegetables, engage in regular physical activity. People who are overweight or obese may also benefit from joining a local weights group or even by receiving support and counselling from trained healthcare professionals to help them better their relationship with food and develop different eating habits. More publicity, more promotion, and more education on food, nutrition, and consequences of a bad diet, I believe, Mr. Dowd, are absolutely essential. However, whilst very important, tackling obesity is not just about an individual's effort, and we need to see cultural and environmental changes too, while ensuring everyone is given the necessary information to make healthy choices. Because of our fast-paced lives, we have become different in our eating habits in recent decades. A huge increase in eating fast food, more and more people eating out, eating high-calorie food, buying hot food from takeaways that sell high-fat, high-salt and often high-sugar foods. Whilst it's good to see businesses thriving, it's incredibly worrying that some are exacerbating the problem and increasing the sugar and calorie intake of our nation. Treats are fine, and we shouldn't be jobs comforter on these sort of things. We should look at special occasions, but not the mainstay of an individual's diet. Our food environment affects our individual behaviour and has a significant part to play in reducing obesity. Parents are crucial in this as the primary educators, and education is vitally important. It can be very difficult to make healthy choices if you're blissfully unaware of the contents in the food you're eating. I know from personal experience when we do the weekly shop, identifying the healthiest products is not always as easy. That is why we have to ensure labelling of products in shops, cafes, restaurants, coffee shops, fast food outlets and the rest. So individuals can make an informed choice. Essentially, the healthy option should also be an easier option for everyone on the menus. Research shows that when governments act on this issue, they have a positive effect. Our own government has done some excellent work in this area. The voluntary traffic light scheme, which was introduced jointly by the UK government and devolved administrations in 2013, has been incredibly successful. Restrictions on the placement of unhealthy foods in supermarkets and shops have been hugely popular and stopped shops from using children and pester power to hassle adults into buying these items. And the soft drinks industry levy is having an impact by encouraging reformulation and decreasing the volume of sugar in soft drinks. Advertising, however, more needs to be done, and advertising on television is still a real concern as far as I'm concerned. Restrictions on before 9 o'clock are due to come into effect in October 2025, having been originally planned for the 1st of January 2023. Disappointing that there's been a delay, but understandable. These are actions that need to be taken, and I know my right honourable friend, the Minister, will take them on board in the dynamic way that she does in her role. But in conclusion, Mr Dowd, serious action is needed, and tackling the obesity epidemic is the responsibility of all of us. The government, food, schools, families, industry, politicians, local and national, regional, or whatever. Everyone has a part to play. It's also something that I think we can unite on across this House, because it's an issue that affects everyone's constituents and every person in the country. And I know the opposition and ourselves on this side would want to work together with the Scottish Nationalists and others in the chamber to make sure that we do this. Because if we don't, it's costing our NHS billions of pounds a year, has a huge detrimental economic effect, but most important of all, it affects our constituents, particularly our children. With strategic policy interventions, we have the opportunity to turn the tide against obesity, improve our nation's health, and enhance people's quality of life, prevent needless early deaths, and secure the economic future for our nation. I hope my right honourable friend will listen carefully to what I've had to say, and that colleagues on all sides of the House will endorse the fact action is required.
Thank you. The question is that this House has considered the matter of tackling obesity. Sarah Dye.
Thank you, Mr Dowd. It's a pleasure to serve under your chairship this afternoon, and I congratulate the Honourable Member for Bexleyheath and Crayford for securing this very important debate. Mr Dowd, whenever possible, I like to talk about the accomplishments of my constituents. One constituent made an outstanding contribution to tackling obesity 8 years ago, and I am glad that the Honourable Member has recognised the efforts, because my constituent is the former Chancellor who introduced the soft drinks levy in 2016. This policy has meant a 46% fall in average sugar levels per soft drink product since 2015. Sales haven't been affected. Actually, they've increased by 14.9% over 4 years. And this levy has been a remarkable success. The Medical Research Council estimates it has prevented about 5,000 cases of obesity in Year 6 girls and 5,500 hospital admissions for children with tooth decay within 5 years. So, Mr Dowd, this is unambiguous and indisputable. Interventionist health policies are the only way to solve our obesity crisis, because the food system in this country is rigged against us. Now, this isn't just a crisis. In Somerset, 34.6% of children leave primary school overweight or obese. but 21.8% of 5-year-old children start primary school overweight or obese. In 2021, 60% of adults in Somerset were overweight or obese. We should be one of the healthiest countries in the world. We have an NHS that covers every citizen, a mild climate, a high level of economic development, but we're not. 30 years of failed government obesity policies tell us we must change. A University of Cambridge team analysed 30 years of government obesity policies in England, 14 obesity strategies with 689 individual actions. 8% fulfilled 7 criteria identified by researchers as necessary for successful implementation, and 29% didn't meet a single criterion. We've tried blaming the individual, and it hasn't worked. It's not just remiss, it's wrong. The charity Beat reported, strategies harmful to people with eating disorders appear to be ineffective at reducing obesity. By refusing to change the system and telling people they're to blame, we are killing people who are already vulnerable. And there is a consensus. Polling from the Food and Farming and Countryside Commission and More in Common last September showed that 77% of participants want government to put health standards over cost. And 67% think that the government isn't doing enough to safeguard children from unhealthy food and drinks. The status quo simply cannot continue. Our farmers are underpaid, undervalued, and underused in a food system that doesn't prioritise healthy local food of high standards. Small and medium UK agri-food businesses can't compete with cheap, ultra-processed food. Our NHS staff are so overwhelmed in dealing with the results of obesity that they have little time or budget to deal with the causes. Mr Dowd, we Liberal Democrats want a robust, thorough obesity and food strategy that meets all 7 standards specified by Cambridge. We want junk food advertising restricted on TV and online, as the Honourable Member has mentioned. We want public sector food procurement strategies which benefit the farmers and local businesses producing the food. We want to extend the polluter pays principle we have for water companies. We want to make junk food giants either change their ways or pay their way. And as a serving Somerset councillor, I know how vital it is to empower local authorities to develop and manage tailored strategies in their areas. Give local authorities more power over planning to prevent high streets getting clogged up with cheap fast food outlets and to restrict junk food advertising. And let them develop food partnerships with farmers and agri-food businesses. Mr Dowd, we must have a new interventionist approach to our food system. All other approaches have failed. It makes economic sense, it makes environmental sense, and it makes moral sense. Let's make a better food future. Thank you.
I'm going to give members 5 minutes. Minister will have 10 and the opposition spokespersons will have 5 minutes. Andrew Sullivan.
Thank you very much. And congratulate my honourable friend, and I agree with pretty much everything the honourable lady has just said. As well. So in July 2020, the House of Lords produced an excellent Select Committee report, Hungry for Change, Fixing the Failures in Food, which is pretty shocking. We are one of the most overweight nations in Europe, and that's not an accident because our diet is pretty appalling. And this report from the House of Lords on page 19 says that in the UK, 50.7%, over half of all our dietary energy comes from highly processed foods, whereas in Italy, it's only 13.4%, and in Portugal, only 10.2%. So, our diets are just so much worse than some of our fellow European nations. We are bombarded with advertising for the unhealthy foods. In 2017, £300 million worth of advertising was spent on less healthy foods compared with only £16 million a day. And we're doing really badly on even just our 5 portions of fruit and vegetables a day. Only 31% of adults are achieving that, and only 8% of teenagers, and parents in the room will recognise the challenge there. And all these figures are worst for the poorest members of our society as well. And I commend the Times for what they've done with their excellent Health Commission report, Chapter 10, and some of their recommendations. They think it's outrageous that some of this highly processed food can have natural and organic on the front. I think that is deceptive. I think it is misleading. And I think a lot of the big food producers have a lot to answer for. The Times say that all children should learn to cook properly, and those lessons should be inspected with as much rigour by Ofsted as maths and English are. And this matters. If you tip up at university and you can only open a packet and put it in the microwave, then, you know, you're probably not set on the most healthy life, and it'll probably cost you more as well. Children are bombarded with these images, and Bite Back, with whom I've worked very closely, they want to get rid of the use of cartoon characters and other child-appealing tactics on our food, hooking our young people into unhealthy food. The Times also says that we shouldn't just have environmental, social and governance for our businesses. It should be environmental, social governance and health as well, because employers can do their bit as well. How do we know how many calories we are eating per day? I, as a man, am supposed to eat no more than 2,500 calories a day. Women, 2,000. How do we know? You know, they're tiny signs in some of the restaurants. Tiny. You know, let's make it easy for people to do the right thing. And that is generally quite a good strapline. Make the right thing the easy and affordable thing to do. I salute my local markets in Leighton Buzzard, Dunstable, and in Houghton Regis, who provide fresh fruit and veg, you know, openly available at often very good prices. I have to say my supermarkets do as well. We all know that exercise is important. A little caveat on that. They do say you cannot outrun a bad diet, but of course exercise is always, in every circumstance, brilliant for all of us, and we should all do more of it. And finally, I would just say, and it was great to hear a speech from the Liberal Democrats, because you know, this is not a nanny state, entirely private matter, what we eat. And I'll tell you why. Children don't get to choose. They get fed what their parents give them. So what we feed our children really matters. And we have to be honest, there is limited supply in the NHS for all of us. So if other people, you know, eat really, really bad food, that means there's more capacity taking up in the NHS, dealing with the type 2 diabetes and the cancer and all the heart problems and all the other issues. So we all have a stake in us all eating well, and I hope we can combine on that issue.
Anderson.
Thank you. It's a pleasure to serve under your chair, Mr. Dowd, and I congratulate the member for Bexley-Heath and Crayford for securing this important debate. And as he said, it affects all of us MPs because it affects so many of our constituencies. It's something that affects people and families across the country. I'm here because I recently visited Putney Mead GP surgery in my constituency. It's a really large surgery serving 25,500 people with 23 GPs. And they know what they're talking about. It's an excellent facility. But I spoke to the doctors about the issues they're facing, and I said, what are the main issues? And they said the main issue is childhood obesity, and that's what I want to focus on today. They're worried about the current state of the NHS being able to provide services to support childhood obesity, but also about the lack of services for primary school children, where early intervention is very, very important in tackling childhood obesity. But also they're very concerned about continuing education. And then they say that they talk about the provision that there are provided by Wandsworth Council for primary school children, but that ends at age year 6. And so in secondary school, there's even less provision and support for tackling obesity. And they identified that as a key issue. Today, 2 in every 5 children in England are overweight or obese by the time they finish primary school. And this has lasting consequences for physical health, for mental health, for the quality of their life. The National Child Measurement Programme found in 2021 to 22 that 10% of reception-age children in England were obese. And the proportions were higher amongst Year 6 children, with 23.4% being obese. So something is going wrong in our provision and support programmes for primary school children. But childhood obesity is a significant concern in my borough of Wandsworth, where over 1/5 of children in reception are overweight or living with obesity. And this figure rises to 37.7% of children in Year 6, which is higher than the rest of the country. Wandsworth Council does have several programmes to tackle this. The Health for Life team runs the Mums, Minis and Kickstart programmes for primary school age children and their families. And the Children's School Food Strategy and the campaign targeting takeaways near secondary schools are all having an impact. But this needs to be amplified and supported by the same programmes across the country as well. And as I said, it needs to be maintained. There needs to be a continuity of this support into secondary education as well as primary. Because in the United Kingdom, the prevalence of obesity amongst Year 10 children is still 23.4%. So you're still seeing 1 in 4 children are being classified as obese. And in London, that is still 37.4% of Year 10 children. So it's essential to continue promoting healthy lifestyles, but there needs to be some other significant infrastructure issues as well. One is an issue about planning. It's about having shops with healthy produce in the right places and easier to access for people who don't have the same amount of transport options. It's about also tackling takeaways near secondary schools, which Wandsworth Council is starting to do, and there are some elements of good practice that can be learnt. Also tackling inactivity in schools, with many playing fields having been sold off, has meant a reduction in access to physical education, to PE classes in school. I've seen that for my own children who've gone through secondary school with significantly less access to PE lessons than I had when I was going through school. Also healthy eating and teaching cookery. I'd like to pay tribute to a great community organisation in my constituency called Bags of Taste, who teach how to eat better for less. And they have a really high take-up, and for those who do take them up, they really enjoy making the kind of food they would get from a takeaway, but that they can cook for less money in their own homes. And those are to be really applauded and supported. Also, there can be much more action taken by supermarkets and action on advertising of unhealthy food. And another excellent programme that I've seen really working but isn't taken up comprehensively enough is the Daily Mile, which started off with a school in Scotland, I think in Stirling, and has been taken up by many primary schools around the country and is tackling this and making a difference. To conclude, Mr Dowd, Labour will tackle childhood obesity with a range of measures, including implementing the 9 p.m. watershed for junk food advertising, getting kids moving with a mandatory national curriculum with more of a wide range of physical activities, free breakfast clubs in every primary school, and taking action to end the promotion of junk foods targeted at children. So we will take action. The current obesity figures are a damning indictment of 14 years of Tory rule which haven't worked. It's time for Labour which will. Thank you.
Thank you, Mr Dowd. It's a pleasure to serve in your chairmanship. I also congratulate my honourable friend from Bexley Heath for securing this debate. Tackling obesity is preventing ill health, and it's not nanny states, and I want to make that very, very clear, because good health provides choices. And I think we've already looked at this through the way that we're tackling smoking, and I commend my right honourable friend, the Minister, for her proposed actions on this, because smoking is an addiction. And obesity, or the addiction to foods high in fat, salt and sugar, is becoming an addiction. So we need similar world-leading action to tackle obesity. Because I think it's the Obesity Health Alliance that actually said that that obesity is the new smoking. We've already heard that 30% of adults are obese and 25% of children starting school are either obese or overweight. So we do need to take some serious action. And the food giants are really making us addicted to food that is high in what I've already said, fat, salt and sugar. So we need to tackle this too in the same way that we're tackling smoking. Because obesity causes cardiovascular disease, type 2 diabetes, cancer, and non-alcoholic fatty liver disease. There's a reason why the food giants are spending huge amounts of money on advertising for chocolate, crisps, biscuits and ice cream. And much of this is marketed at children. And it's because the marketing of these products makes them profit, huge amounts of profit. Now, I'm not against profit, but I'm against people profit when it comes to the expense of people's health, and in particular the health of our children. And a recent study that's been carried out by Oxford University shows that 7 of the top 10 global food manufacturers make 2/3 of food and drink sales in Britain from unhealthy foods. So in 2022, it was estimated that the biggest manufacturers spent £55 million on online adverts for food and drink products that were associated with childhood obesity. I've no doubt that this didn't decrease in 2023. I don't think it'll decrease in this year as well. So in addition to the marketing, the packaging of unhealthy food is also designed to appeal to children, as my honourable friend from South West Bedfordshire implied as well. And I think this is similar in a way to one of the issues that my honourable friend the Minister is tackling, and in the way that disposable vapes are marketed to children. I think the way that unhealthy foods are marketed to children need to be sorted out as well. Because children and young people don't ask to be bombarded with these ads that they see time and time again, and yet they are being bombarded. They can't escape them at all. And that's why action from government is needed, and it's needed now. So I'd like to ask my right honourable friend, the Minister, to update the House on the progress being made on the implementation of the measures in Section 172 of the Schedule 18 to the Health and Care Act 2022 on the advertising of less healthy foods and drink, to make sure that we're on schedule to deliver those messages. And going back a number of years, as the Honourable Lady from Somerton and Froome mentioned, the then Chancellor of the Exchequer introduced the soft drinks industry levy. People at the time said it wouldn't work, yet it has worked. It's cut huge amounts of sugar out of soft drinks across the board. I think we need to look at that sort of measure, see how we can replicate that for other foodstuffs. And I'm actually quite proud, because I was a member of the Health Select Committee at the time that asked for that measure to be put in place. And I think it's one of the great achievements of the Health Select Committee, and we can do more than that. So we need to apply that type of measure across food and drink production to incentivise healthier food and drink. But the manufacturers and the retailers do want a level playing field. It's important that we do that. So in conclusion, Mr Dowd, we do need to tackle obesity that was first identified by government as an issue and as a priority in the early 1990s in the Health of the Nation White Paper. Over 30 years on, and we're still only talking about tackling obesity. The health of our nation is running out of time. We need action, and we need action now.
Thank you, Chair. It's a pleasure to serve under your chairship today, and I congratulate the Honourable Member for Bexley Heath and Crayford for securing this debate. In the context of the ongoing Tory cost of living crisis and an increasingly unhealthy population, it's important that this debate takes place today. So I definitely welcome him bringing this to the Chamber today. Chair, huge financial pressure and high food prices are forcing families to eat less healthily, getting cheaper calories from unhealthy foods. There is a clear link between deprivation and obesity, which is why tackling health inequalities and tackling poverty are top priorities for the SNP Scottish Government. We've heard lots of interesting contributions this afternoon. The Honourable Member for Bexley Heath and Crayford touched on the issue of junk food advertising, the issue junk food advertising poses. I discussed this exact issue with the University of Glasgow just earlier on this afternoon. We need to be incredibly mindful of where, what and when we're advertising, because the reality is, by not being mindful of this, we're having an often detrimental impact on health inequalities. The Honourable Member for Somerton and Frome also spoke a great deal about child obesity, which I'll come on to further into my speech. I very much agree with her on this point, But I'd welcome an intervention from her on how her party's abandonment of free tuition is having an impact on household budgets, and thus impacting people's ability to access healthy foods. The Honourable Member for Putney's mention of the Daily Mail, which originated in Stirling, was hugely welcome. It was nice to hear a non-Scottish member cast a light on a project which originated in Scotland, so I certainly welcome her for that comment. Obesity is a problem which is escalating on a global scale, but sadly these effects are being felt severely in Scotland, with 67% of all adults being deemed overweight and a further third of children being at risk of becoming overweight. This same survey found that obesity was more common in households with lower incomes, a correlation we know and recognise all too well. This is why myself and my SNP colleagues are consistently calling on the UK Government to take action on tackling the cost of living crisis, improving universal credit and reversing their policies which deny families crucial support. These are things which the Scottish Government do not have the levers to be able to do at the moment. Therefore, what the Scottish Government do is mitigate for the bad political decisions made in this place by reducing family household costs through providing free prescriptions, free school meals, free childcare, free period products, free university education, free bus travel for the under-22s and for those over 60, and freezing the council tax, providing the young carers grant, providing the Scottish child payment, providing both adult and child disability payments, all whilst mitigating against the bedroom tax, the rape clause, the benefit cap and real terms cuts to social security. Earlier on today I met with Professor Ian McInnes of the University of Glasgow, whose project Creating Healthier Places, a place-based approach to research and partnership, factors in access to healthy foods into their research into 20-minute neighbourhoods. This is a fascinating project which I would urge the Minister to have a wee look at. I think she'd be just as impressed as I am. The Scottish Government have also provided over £180 million to low-income families to help with expenses during their children's early years through the Best Start grants and Best Start food applications. The eligibility for Best Start foods will also be expanding so that a further 20,000 people can access support to buy healthy foods. These kind of steps are essential to ensure that support is there for the least well-off families to be able to make healthy food choices. Chair, in my own constituency of East Dunbartonshire, new data from cancer research has shown that 22.5% of 4 to 5-year-olds are overweight or obese. That's 4 to 5-year-olds who are already increasing their risk of serious illnesses. That is not a choice on behalf of the children, it is not a choice on behalf of their parents, it is a symptom of families not having the resources to provide healthy options, it is a symptom of 14 years of austerity, it is a symptom of being tied to this broken Westminster system. I know the Minister cares deeply about these issues and will give a compassionate and considerate response. I simply urge her to mirror some of the Scottish Government's policies in tackling health inequalities. Chair, this is why in Scotland all primary school pupils in primaries 1 to 5, all children in ASN schools and eligible pupils in primary 6 through to S6 can benefit from free school meals. The most generous free school meals offer anywhere in these aisles, saving families.
Thank you.
No problem.
Mr Dowd, and it's a pleasure to serve under your chairship, and I want to thank the Honourable Member for Bexley Heath and Crayford for securing this debate. I know he's been a strong campaigner for tackling childhood obesity over many, many years, and I thank him for his remarks today. As many colleagues have rightly highlighted, the obesity epidemic is a genuine crisis. It will be the next big public health issue that we will all be talking about in a few years. 60% of us are now overweight, 1 in 4 children in England are now obese by the time they leave primary school, and it means those children are 5 times more likely to go on to develop serious and life-limiting diet-related conditions in adulthood like diabetes, CVD, liver disease and certain forms of cancer. And of course it means more pressure on the NHS, which as we know is already buckling under the weight of demand after years of mismanagement by this government. And it's a disaster for the taxpayer. Frontier Economics estimates the impact of obesity to be £98 billion a year in NHS and social care costs, lost productivity, workforce inactivity and welfare payments. So I want to thank many of the members today for rightly focusing their remarks on the poor food environments children are growing up in and what we as policy makers can actually do about that. In recent decades, action on obesity has overwhelmingly focused on measures to get people to change their behaviour without tackling the structural factors that influence them. And we know that isn't enough. 99% of us know that it's important to get your 5 a day. Most of us can tell each other what a healthy diet looks like, and every week there seems to be some new fad diet. But the bottom line is the nation's waistline. Britain is getting fatter. It is therefore disappointing to see the Secretary of State say she believes that the priority for preventing obesity is to give people information about nutrition with no measures to fix the food environment. And it appears to be at odds with her views on tobacco, where the government rightly have taken up measures to further protect children from tobacco harm. So she does not believe measures to inform children about the dangers of tobacco alone are sufficient to solve that issue. So why does she believe this for obesity? And if giving people more information is the solution, can she explain why obesity rates are twice as high in our poorest areas than the richest? Mr Dowd, Labour believes every community in the UK should be a healthy place for children to grow up, learn and play. Businesses need a healthy workforce to drive economic productivity and sustainable growth, and it is the government's job to make the healthy choice the easy choice. There was a moment, I think, in 2020 when it looked like every party across the House believed this, when the government brought forward the 2020 obesity strategy, welcomed by doctors, parents, health charities, and, as the Right Honourable Member for Bexley Heath said, received cross-party support, and a strategy that contained evidence-based measures to really begin to fix the food system by stopping our children being bombarded with junk food adverts as part of a major commitment to halve childhood obesity by 2030. So I'd like to ask the government today what's happened to that commitment. And since the government kicked that flagship policy into the long grass, delaying the policy for the next government to deal with in October 2025. So is the government still committed to halving childhood obesity by 2030? And what have they done since delaying the junk food advertising policies? The need for action hasn't gone away, as we've heard today. The health of our children is in a dire state, and it's getting worse. It was once thought that it was essentially impossible for children to develop type 2 diabetes so early in life as a result of their diet. But as we heard from the member for Bexley Heath and Crayford, we are now seeing thousands of cases of children developing the condition more every year. Nearly 4 in 10 children with obesity are estimated to have early-stage fatty liver disease, and tooth decay remains the single largest cause of hospitalisations for young children in England. And the government assures us that the regulations on junk food advertising were merely delayed to give industry more time to prepare. Why then, if this is the case, has the government refused to bring out the supporting secondary legislation for these regulations, which are now months overdue? And surely the Minister agrees that it would help the industry prepare for these regulations to have this detail available to them now. Labour want to tackle the structural drivers of ill health and be led by evidence, not ideology. And that starts with delivering the measures that the government has failed to implement to protect children from junk food. So we will restrict adverts of foods high in fat, sugar and salt in favour of healthier options. We will improve children's diets by finally implementing the 9 p.m. watershed for junk food advertising on television and ban paid-for advertising of less healthy foods on online media. Tackling health inequalities is a central part of Labour's health mission, and we won't resort to the tired excuses that would blame families in Blackpool for having poorer health than someone in Banbury. Instead, we need to focus on making healthy food more affordable and accessible, as we've heard today, and schools will have a role and responsibility within that, and that's why our fully funded breakfast clubs in every primary school in England will serve healthy and balanced food to embed healthy habits and boosting children's concentration and development. The Minister will know that the government has undertaken some assessments of the health impacts of the National School Breakfast Programme at the time when it was running. It'd be really good to hear what some of the evidence was, because actually we heard from schools that it improved pupil behaviour, improved their readiness to learn, it improved social skills and eating habits. And to conclude, I want to leave you with a statistic to reflect just how stark this issue is. Not only are our children fatter than their peers in other European countries, but actually they are shorter than our European peers. Thank you.
Thank you, Mr. Dowd. I want to congratulate my right honourable friend for raising this very important issue and thank all honourable members for their contributions. There is no doubt that this country faces an obesity challenge, and I am reassured by the contributions from everybody today that none of us underestimate the scale of the task ahead. Now, Mr. Dowd, as others have said, 2/3 of adults in this country are living with overweight or obesity, increasing their risk of many serious diseases. So tackling it head on is not just the right thing to do for patients, but it makes good economic sense too. Obesity-related conditions cost our NHS £6.5 billion directly every year, while the cost to wider society is a staggering £58 billion, and as my right honourable friend said, some estimates put it at over £90 billion. Now, my great passion is for giving every baby the best start for life, and there's no doubt in my view that prevention is not only kinder, but also much cheaper than cure. So food given to babies and young children helps establish food preferences at an early age. So it's vital we build those healthy eating patterns as soon as possible. Nearly 1 in 10 children starting primary school are already living with obesity, doubling to nearly 1 in 5 by the time they leave. And growing numbers of children with excess weight are, as honourable members have said, developing health conditions once rarely seen in childhood, like high blood pressure. Every child needs an environment which helps them to thrive and reach their full potential. Now, of course, that's easier said than done. There's no single solution, no magic bullet to solve this problem. That's why we're delivering an ambitious programme with 4 strands. Firstly, we're supporting families to make healthier choices through more advice and better information. This starts at the very beginning of life with our national breastfeeding helpline for parents who need support. And the Start for Life website is a rich source of helpful advice. We're backing family hubs with £300 million so that new mums and dads have the best advice, including on children's nutrition, with one-stop shops across England. Weaning is a critical time for establishing healthy eating, so we're working on voluntary industry guidelines to reduce levels of sugar and salt in commercial food and drink aimed at children up to 36 months. And we've begun a 4-week period of engaging with industry to make sure we get this right. For older children, families and adults, we provide a range of materials, tools and apps to encourage eating better and moving more. This can all be found on our Better Health website, and I do encourage all honourable members to recommend it to their constituents. I'm also proud of action we've taken to mandate calorie labelling on websites and delivery apps for all large restaurants, cafes and takeaways. And we've prohibited the promotion of less healthy products at key selling locations to help people stave off those impulse buys, because we all know people are not making those choices consciously. They're unconscious choices being hugely promoted by incredibly strong advertising and marketing. So we know it can be very challenging for some families to make healthier choices. So we're investing over £200 million a year on 3 healthy food schemes: Healthy Start, the Nursery Milk Scheme and the School Fruit and Vegetable Scheme. Now, Mr Dowd, secondly, we're promoting more physical activity, which does help people maintain a healthier weight. The government is investing over £600 million in school sports over the next 2 years via the PE and Sport Premium and School Games Organiser network, so that children can get more active. And we also have the Couch to 5K and Active 10 apps to promote everyone getting more active. The third measure is supporting those already living with overweight or obesity to achieve and maintain a healthier weight. We've delivered a free NHS weight loss app, and local authorities are funding local weight loss services from their public health grants. The NHS provides a digital weight management programme and many specialist services, and we're now exploring ways to increase access to the newest weight loss drugs to more people who are eligible. Fourth, a really critical point, as lots of right honourable members have raised, is our work with the food industry itself. Sadly, there's been a long-term trend towards producing and marketing foods high in calories, saturated fat, salt and sugar, a race to the bottom, and we will reverse this trend. Our soft drinks industry levy has already made huge strides in bringing down the sugar content of soft drinks by almost half between 2015 and 2020, removing a staggering 46,000 tonnes of sugar. Our voluntary reformulation programme requires all sectors of industry to reduce levels of sugar, calories and salt in the everyday food and drink that people buy. If we can see this through, consumers will have many fewer calories in their diet, without them having to consciously change what they eat. But whilst the salt and sugar reduction programmes have brought some progress, there is much more to be done. And unfortunately, the Calorie Reduction Progress Report, published just this month, showed little change in calorie levels between 2017 and 2021. So I've asked industry to meet the reduction targets for calories and sugar by the end of 2025, and we will leave no stone unturned if they don't live up to our expectations. So I'm pleased to assure the House and my honourable friend for Erewash that we remain committed to introducing further advertising restrictions to reduce the marketing of less healthy food to children. And we will also bring in restrictions on volume price promotions, such as 3 for the price of 2 on less healthy foods in October next year. And we will back local government in using their powers to support a healthy local food environment. So I will end, Mr Dowd, by reiterating that obesity is a significant, not just UK, but global challenge, and we all have our part to play. So I have personally been engaging with industry throughout my career, from the Treasury to BEIS to DEFRA. Business people say they want a brighter future for all our children, and I plan to make sure that they deliver on that. Thank you.
Thank you. David Evans to wind up.
Thank you very much, Mr Dowd, and I'd like to thank everyone for participating today in a very constructive way, and I think this is the way we all should be going on such an important issue. I'd like to thank particularly the Minister for her excellent response, and I think we've had some really good issues raised by all colleagues on all sides and by the Minister to look forward to doing something to make sure that this crisis that we have of obesity is overcome. I think it is so important for our children particularly, but also for our adults and for quality of life. And therefore I'm grateful for the participation and grateful for all the ideas that have come forward that we shall have to look at and think about. And I know the Minister will take this away. But particularly thank you to the Minister.
Thank you. The question is that this House has considered the matter of tackling obesity. As many as of that opinion say aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting stands adjourned. Thank you.
The proceeding has ended. 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 The proceeding has ended.